Hello, I'm Dr. Carolyn Richardson, and this is Tips After the Visit, information that has been helpful to my patients and their parents. You might find this information useful also. For some subjects, you may want to discuss the information with your child's pediatrician or healthcare provider to make sure that the information is right for you and your child. Today, I will be talking about normal fine motor development for children aged 12 months to 3 years. During this era of high-tech portable devices, don't forget the basic toys like crayons and paper, balls, building blocks, and safety scissors. After the first birthday, children develop many skills that they will use for the rest of their lives. During the well-child visit, development is assessed to make sure that the child is progressing on target. During well-child visits and assessing development, I have noticed that for the most part, children still walk and talk on time. But skills like fine motor, personal social, and problem solving are starting to fall a little behind. Today, we will be focusing on fine motor skills. Fine motor skills use the small muscles of the fingers and hands to make movements that are guided by eyesight and the brain working together. Young children need to develop good hand-eye coordination and should still be learning to write on paper, to use a spoon or fork, and to put a shaped object into an opening of the same shape. I found a website by the Children's Therapy and Family Resource Center that listed the developmental milestones for each age group. Let's go through these milestones. Did you know that between the ages of 12 months and 3 years, there are 6 well-child visits? Each of these visits is very critical because the child's development is being monitored. Children see the doctor at 12 months, 15 months, 18 months, 24 months or 2 years, 30 months or 2.5 years, and 36 months or 3 years. Normal development that should be achieved for a child between 12 and 18 months should achieve these type of activities. Pointing to pictures in a book. When you read to the child, if there is an image of a cat or an apple on the page, stop and ask the child, "Where's the apple? Where's the cat?" and give the child an opportunity to point to it. That way, the child will begin to learn the identity of different items in their environment. A child 12 to 18 months should be able to build a tower using 2 blocks, stacking one block on top of the other without knocking the blocks over. They should be able to hug a toy close to the middle part of their body, scribble with a crayon, that's getting them ready for writing, point to an object using their index finger, hold a cup and drink, understanding that they may spill a little bit of the liquid. They should be able to eat using a spoon, understanding that some of the food may spill off of that spoon. Children at this age, 12 to 18 months, should be able to pull off their socks and put a hat on their head. Areas of concern is if the child is 18 months of age and is not able to use the pincer grasp. That means they don't use their finger and thumb to pick up small objects. If the child does not point to objects, if the child is not able to put objects into a container, if the child is not using both hands when playing and moving objects around, and if the child's movements seem to be shaky or stiff, you want to mention this to the child's pediatrician or medical care provider to make sure that additional assessment is not needed. If there is a delay or deficiency, this can, if it's caught early, Many times this can be corrected with physical therapy or occupational therapy. The next age group is 18 months to 2 years. Children in this age group should be able to build a tower that now has 4 to 6 blocks. They should be able to stack these blocks one on top of the other without knocking them over. They should be able to put 4 rings on a stick, 1 ring at a time, slipping them onto the stick with good hand-eye coordination. They should be able to put pegs in a pegboard, turn the pages of a book. Sometimes they might grab 2 or 3 pages at a time. They should be continuing to scribble, also turn knobs, throw a ball, paint on paper using a paintbrush. This movement may be accomplished with their arm a little stiff, but that's okay. They should be able to imitate if you draw a line or a circle. They should be able to copy that. They should be able to take large beads and thread them on a large piece of string. They should be able to eat using a spoon and a fork. They should be able to pull up a large zipper, such as on a jacket or a sweater. They should be able to hold a crayon with but a lot of times they'll have their fingers at the very top of the crayon to color, draw, or scribble. And they should be able to put large shapes in a shape sorter. A shape sorter has openings the size of various shapes, and the child should be able to pick up a shape and put it in the opening that's the same shape on the sorter. Areas of concern: if you have a 2-year-old child who cannot imitate drawing a vertical line, if there are still children at this age are still putting toys in their mouth the way they did when they're 6 or 9 months old, this is not normal. If the child is not able to put a simple puzzle together that has 4 or 5 pieces, if the child is not able to put the right shape in the right opening on a shape sorter, if the child is unable to feed with a spoon, and if the child is not able to stack 2 to 3 blocks on top of each other without knocking them over, this could be an area of concern. You should mention this to the child's pediatrician or medical care provider to make sure that additional assessment is not needed and if any intervention may be required. For children ages 2 to 3 years, they are really using their hands now. They should be able to fold a piece of paper in half, draw circles and lines on paper. If you draw and show them how to draw a cross or a plus, they should be able to imitate that on paper. They should be able to use safety scissors to snip the edges off of paper by the time they're 2 1/2. And they should hold crayons using their thumb and fingers, similar to the way an older child or an adult would hold a pen or a pencil. They should start now using one hand more than the other, indicating if they're going to be left-handed or right-handed. Now when they build a tower using blocks, they should be able to stack as many as 9 blocks without knocking the blocks over. And they should start using other blocks that click together, such as Legos or Mega blocks, to build small and simple structures. The movement of their fingers and thumb should be so well now that they are able to thread a 1/2 inch bead onto a piece of string. When the child is 3 years old, they should be able to use safety scissors to cut across the entire piece of paper. They should be able to eat well with a fork and able to manage buttons. They should be able to button a large button on a sweater or coat. And they should be able to put most of their articles of clothing on, socks, shoes, top, pants, with some supervision from you. Areas of concern for a 3-year-old would be if children at this age movements seem shaky or stiff, if their arms or hands seem to be a little weak, or if the child is holding the crayon in their fist and using this way to color. If the child is not able to hold scissors and paper and cut, if the child is not able to draw lines and circles, and if the child is not able to stack blocks one on top of the other without knocking them over, all of these would be areas for concern. You would want to mention this to the child's pediatrician or medical care provider to make sure that additional assessment is not needed and intervention is not required. Well, that's all for now. You can make sure that your child is developing normally by checking resources found in printed materials, online, and at the library. When you're at the medical office, check and see if there are displays there that may have free pamphlets, handouts, or cards that have the different milestones for each age group. Check each week for more tips after the visit. Thank you.